Good evening, welcome everybody. I'm Steve Jane, I'm head of the Central Clinical School, and in the next 10 minutes or so I have to give you compelling reasons why you will choose AMREP to come and do your honours versus Clayton or anywhere else. So this evening you're going to get a blurb from me for about 10 minutes or so. Then Jodie's going to talk about the honours experience at AMREP and how fulfilling in her life it was and why you should all follow that path. And then Mark, who's the honours coordinator for immunology, which is one of the 3 honours streams that are offered at AMREP, will talk to you generically about honours streams. But if you want specific information about the 3 honours programs that are offered here, then the head of honours for each stream is shown on my slides, and I'll talk to that very briefly. So, the point of difference that I really want to emphasise to you is that the AMREP site is a clinical site. It is where the university and the hospital, and indeed our research institute partners, the Baker and the Burnett, have forged links together that are unique to this site by virtue of the fact that a hospital sits right next door. Now that differs from Clayton. They have Monash Medical Centre down the road, but they don't have the patients literally sitting outside of the laboratory. And I think for those of you who are interested in what we call translational research, which is the transition of scientific and basic science knowledge into patient outcomes, clinical outcomes, changes in how we look and diagnose and treat patients, that is something that is unique to this campus because of really the relationship between the research laboratories and the clinical units, which are intertwined. So, I think it would be fair to say that this precinct is one of the finest translational precincts in the country. In fact, if you look at the standard metrics for grants awarded, papers published and so on, the AMREP precinct, so just here, was the 4th largest academic precinct in the country last year, behind Monash University as an entirety, Melbourne University as an entirety, University of Queensland, and then AMREP just here was 4th. So it's a powerhouse of research. It's not just a little outpost from Monash University. And it's composed of the 4 partners, being the Alfred, the University, the Baker and the Burnett. And those 4 are all integral to the success of the precinct. So each of the components have different departments. The Central Clinical School has a range of clinical departments which include haematology and immunology, gastroenterology, infectious diseases and so on. Baker obviously has an international reputation in cardiovascular disease and diabetes and metabolic disease. The Burnett obviously infectious diseases, and then the School of Public Health and Preventative Medicine also has a range of clinical and global health departments, including rheumatology, infectious diseases, clinical trials, health promotion, registries and so on. So I think you'd have to be a pretty fussy eater if there wasn't something on that menu that appealed to you. I mean, that's the challenge for us, is to say, can we galvanise this interest to translate it from our perspective into getting you to sign up to do honours here. As I mentioned, the advantage is the exposure to the patients, the exposure to clinician scientists. Most of the unit heads, both in public health, Burnett, Baker and the Central Clinical School, are clinician scientists, so they understand that interaction between science and medicine. And I think stepping beyond your honours, which I know you all think about from time to time, there are tremendous high degree research opportunities here in the PhD, and I'm going to touch on that a little bit later on. So, as I mentioned, there are 3 streams available to you, and this is new this year. We've changed it. It used to be that if you wanted to do honours here, you either had to enrol in public health or in immunology, but we've now developed a 3rd honours stream which stems from the human pathology course, or HUP. So the bottom line is, if you want to do immunology at AMREP or Clayton or Monash Medical Centre, but immunology alone, you enrol through the immunology course here. Mark Wright, sitting down the front here, is the honours coordinator, and he's going to talk to you shortly. If you want to do honours in any of the other clinical departments, so Baker or Burnett or all the Central Clinical School departments, including except immunology, including haematology, etc., then you enrol through the human pathology honours stream, or HUP. The honours coordinator for that is Justin Hamilton, who I don't know if he's in the room, but certainly floating around, and he can direct you to any of those partners. You can't get to those partners from immunology. So if you want to work in immunology, you go there. If you want to work in anywhere else, you go to HUP. Or thirdly, if you want to work in public health, in all the departments in the School of Public Health and Preventative Medicine, then their honours stream is also there, and Jay is their honours coordinator, and Jay is here somewhere as well. So, apart from the unique opportunity of translation, I think the other aspect that I always highlight every year are the surrounds of Paran. This is when I go into real estate mode. We have beautiful surroundings here, parks and gardens, fantastic shopping at Chapel Street, Albert Park Lake just down the road, a short tram ride to the city, like it's everything you could ever want, really. But I know we are competing with Clayton, and this they have magnificent factory yards, they have burnt-out cars and bus routes standing on the road. So all of you have a think about it. I know it's a tough choice, but we think there are some reasons to come to AMREP over Clayton. And if anyone tells Clayton that I've shown this slide, you will never do honours on this precinct, okay? It doesn't leave this room. So all of you probably know House on the left-hand side. It's a cartoon that I found is where you go from mouse to house, and I think it's a great depiction of what translational medicine is, where you go from basic science or animal models and you try and think what can be the outcome by studying this in patient care. And really when you think about it, I don't know about you, but what gets me up in the morning and makes me think about research is, can I actually discover something today that's really going to make a difference in the life of a patient? A new treatment, a new diagnostic, something that's really going to change the human condition. And I think many researchers aspire in that way. Our funding bodies ask us to think that way more and more emphasis being placed on where your research is going to lead. And I think this is the precinct that allows you to translate those thoughts into outcomes. So just as an extension of that, many of you thinking of honours are thinking, well, what lies beyond this? What are my career paths? And this is something I think the school particularly and the clinical schools of Monash have thought very long and hard about, because there's no question that the pathway down the road into research is looking murkier and harder as time goes past. The National Health and Medical Research Council are shrinking their fellowship programs, and although many of you might aspire to go forward to be lab leaders in the future, the truth is that not many of you will reach that goal. And so that sort of seems we're herding people down a career pathway with some pretty lousy outcomes at the end. And that, I think, drove us to start questioning, how is Monash training our science grads? What are we actually doing here? And from this came a new offering that this university has created through the virtue of the 3 clinical school called the Translational PhD. It is a unique offering to the University of Monash. It's had a lot of press. It's been in the media in Asia, it's been in the Financial Review, it's been in the Australian and so on, because people actually recognise this as a completely different strategy to training our scientists. The idea is, we understand you're not all going to be lab leaders, you're not all going to get NHMRC fellowships, but how can we train you for other roles in science? Because there are a myriad of jobs in science that you won't be trained for by doing a standard scientific PhD. So the translational PhD, which is shown on this slide, essentially exposes you to a whole raft of aspects of science, including commercialization, bioinformatics, media, ethics, tissue banking, registries, a myriad of opportunities and coursework that you will learn and will allow you to be marketable to big pharma, to media, to journals, to a whole range of legal companies who want advice, etc. So we think this is going to create a much broader aspect for all of you in terms of where your careers might go in science, without saying this is the only pathway you've got. As I said, it's a unique offering in Monash. It won't be long before it's offered across Australia, because we've already had an enormous amount of interest from other universities. And this is the model that's used through North America and certainly some of the better universities in Europe, understanding that we have to broaden our training programs. So for those of you who are thinking beyond higher degree research, I tell you that this, I think, is going to be the pathway of the future for scientific training. Sure, you can still go down the NHMRC pathway and get a fellowship if you're good enough, but it does give you training opportunities in different areas to give you different career options. So, with that introduction, I would love to see as many of you as I possibly can in our honours program for the following year, and obviously as many more as that into the high degree research opportunities. opportunities that we give you. And to talk about those opportunities, Jodie's going to come forward and tell you about life in honours.